I'm Dr. Armin Feldman, owner of Physicians Legal Consultants, along with my partner, Dr. Mike Bummer. This is the first of 3 videos over the next 3 days. We do pre-litigation, pre-trial medical consulting for PI and workers' comp attorneys nationwide. We've found over the years that we're working with a select group of attorneys who seek us out, want to know the medicine in their cases, and want to max out their settlement amounts. Today's video is about not leaving money on the table in cases you negotiate and settle. One of the many things we do to help you is write comprehensive medical summary reports that attorneys use as part of settlement demand letters. In these reports, we opine on all the medical issues in the case based on a review of the medical records, an interview with your client, doing the appropriate medical research, and then writing a report. The consistent feedback from your colleagues over the past 16 years is that we do, in fact, in most cases, help you to settle the case for more money. Let me give you a couple of examples. In the first case, this is a 35-year-old man who was involved in an auto crash. As a result of the crash, he sustained several injuries, including a fracture of both the radial and ulnar bones in his left forearm that required a surgical repair. The surgical repair was deemed successful. The client then underwent follow-up physical therapy. Now, unfortunately, after his treatment, he continued to complain of left arm pain while attending to treatment for his other injuries. The client was dealing with a few different treating doctors. We entered the case about 6 months after treatment for the client's various injuries had started. The attorney wanted us to prepare a medical summary report for the settlement demands. In interviewing the client, he told me the pain in his left arm had gotten progressively worse. In addition, he was now experiencing pain in his right arm and his left leg. He also noticed discoloration of the skin in his left arm. I alerted the attorney and suggested that this man may very well have developed complex regional pain syndrome, and the attorney directed his client to the appropriate treating doctors who, in fact, made the diagnosis. Picking up this previously undiagnosed condition led to complex regional pain syndrome being included as a damage in the case. The attorney told me some months later that the addition of this diagnosis added $50,000 to the settlement amount. Now, in another case, a 59-year-old man fell into a 5-foot deep hole at a construction site while walking home at 10 o'clock at night on a January evening. The construction site had no fencing, no warning signs, no flashing lights. The client hit his head on some rocks at the bottom of the hole and was unconscious for some period of time and was found the next morning. His temperature when he was found was 61 degrees Fahrenheit, and he had multiple injuries. Now, while in the hospital, he was diagnosed with a new case of diabetes. The attorney wanted to know if it could be accident-related. Now, without getting into all the details, I did the research and read the records and then wrote a report, and I found out in my research both physical and psychological trauma can precipitate diabetes in certain individuals. Now, on the basis of my report alone, the diabetes was included in the settlement and the case settled for policy limits of $1 million. Now, don't miss tomorrow's video discussing the particulars of a medical summary report. Finally, please drop a comment below this video and let us know that you enjoyed it. And certainly feel free to ask any questions or to let us know that you have a case.